Hello and welcome to another episode of Issues and Insights. I'm Bryce Shumate from Hardin County Government, and today we actually have our Hardin County Coroner, Dr. Bill Lee, with us today to give us an update on what's going on across the county. So Dr. Lee, good to have you on our show today. I know over the years as a police officer, you and I have worked several cases together, and a lot of times those cases are very unpleasant to be, not because it's unpleasant to be with you, but the cases that you're working on,
right?
Because they always involve a death, and it's sometimes when families are at their hardest times,
worst time of their life sometimes.
Yeah, appreciate your service all these years. How long have you been the coroner for Hardin County?
It's hard to believe. I got elected in 1986, so that's about 35 years as the elected coroner, and then I was a deputy under Dr. Studeville from 84 to 86, so about 37 years total.
And I remember those years being a young man out riding with Laney Evans in a police car when I wasn't supposed to be in a police car,
right.
And Dr. Studeville coming out for a death investigation. So many years, Dr. Lee.
A lot of things have happened, but I appreciate what you've done over the years too, your involvement with the community here.
Well, thank you. I know you and I have given death notifications to family members over the years, and not always a pleasant thing, but at least it was always good company to go with you and be with you when we had to give some of the hardest news that people have to hear.
Makes my job a whole lot easier having folks, the camaraderie and the teamwork that we have established with law enforcement and all the different agencies. That's one of the pluses that I have. I get to work with a lot of different folks, and you guys make my job a lot easier.
And the good thing is all those guys know you and appreciate you, and we were kind of laughing before we came on camera, folks. My son now is at Elizabethtown Police Department, and it seems it carries on now. Daniel got to work with you on a scene the other night. So
I think his first case with the death investigation, I think, and he did a good job. So you should be proud of him.
I am very proud of him. Even though I told him not to get into police work, I am very proud of him that he's doing well, because now I want him to be the best that he can be.
He's a good one.
You know, in talking about how long you've been coroner, you've seen a lot of changes over the years in this profession.
Yes. Well, we look back over the numbers, Bryce. In '86, my first elected year, we worked 145 cases total. There was 4 deputies and myself. 145 cases total. In this last year, 2020, we went over 1,000 for the first time ever.
Wow.
Amazing.
And how many deputies do you have now?
We have 5 deputies now. And of course, we were all part-time back in those days, and now there are 3 of us full-time, and then 3 part-time. So.
And Dr. Lee, people don't really realize how many death investigations you all go on a year. And when we talk about that number, I mean, you're doing at least one. The average would be you're doing at least 1 or more every day, correct?
It's almost 3 a day now.
Yeah.
And there are times when they overlap. Even we have 2 cases going at the same time occasionally.
Right.
And it's going to happen more and more.
And that's, I mean, people don't think about it, that's not only just reporting to the scene of the death, but many times that means you also have to follow up and take them other places.
That's the thing people don't realize, and including even the magistrates probably. A lot of people think our major emphasis is going to the scene of death, but that's the tip of the iceberg, Bryce. The after effect, talking with families, funeral homes, just like on this case the other day we were referring to that Daniel worked with. I've dealt with detectives twice already, and I still have some more work to do there. We have toxicology reports we're waiting on to get back and incorporate that into our reports. A lot of hours after the scene in the initial investigation. So.
And people don't realize how blessed we are. We actually have a morgue that you can take a body to and keep them until such time that you might take them to someplace else, correct?
Right, and sometimes we need to have a little further investigation and bringing the deceased back to there for photography or maybe examining some wounds before releasing to a funeral home or before going to the Louisville for an autopsy. And sometimes families come in to make a positive ID, so that morgue is really helpful to us, very, very much.
Absolutely, so. And not every county has something like that, correct, Dr. Lee?
Correct. 120 counties, and I'd say probably less than 10 have their own morgue or coroner office. Now, a lot of coroners in Kentucky are funeral directors, so they've got a facility they can bring. For instance, our neighbors Meade County and LaRue County, Bullitt County, their coroners are funeral directors, so they can bring families or law enforcement back to that facility for further investigations. So,
right. And we're blessed that we actually have an office where you
right.
can bring folks back in that makes a professional setting.
Sure is, very much so.
Absolutely. I know my personal phone has got a setting on it. An alarm goes off if the cooler gets too warm. You know, in the summertime,
right.
especially. You know, we start worrying. We don't want to thaw anybody
right.
out.
Exactly.
You know.
Interesting.
Dr. Lee, I know we talked about the size of your office now, your employee size, but kind of explain how that works with. I know you have some full-time people and you have some part-time people.
Right.
Can you explain to the folks? A lot of people don't know that. They just, I guess, they take those kind of things for granted. They try
right.
not to think about death, right?
Right. Of course, in Kentucky, the statutes say the coroner is an elected position, and 4-year term. And depending on the population of the county, the elected coroner can appoint deputies. So our size, over 100,000, we're allowed 5 deputies. Jefferson County has about 10 or 12. LaRue County, smaller county to our south, has 1 or 2. So the number of deputies is dependent on the size and the workload and so forth. So, and we've got, Bryce, adding up, we've got over 130 years investigative experience among myself and my 5 deputies. Some counties may not have 5 or 6 years total death investigation time.
Right.
We've got over 130 years. I've got a lot of experience.
And people would say, okay, why do you have so many deputies? Well, people don't realize you're going 24 hours
right.
a day.
And day or night, and sometimes it's out on the interstate. Sometimes we have the 4th largest county geographically, 4th or 5th. So you can be down toward Millerstown, which is on the edge of Grayson County, and you may get a call to West Point in the north end. It may take you 45 minutes going through traffic lights and traffic.
Or longer. Yeah.
Probably longer. So the workload, again, the number of cases, we have deputies. For instance, the other day we had 3 of us at the office working on 3 different cases at the same time, this follow-up stuff we were talking about. And we need the amount of people and just so much involved in the things that we have to be involved in now. A lot more paperwork, data collection, and so forth.
And a lot of people don't know exactly what all your job entails. Can you kind of tell folks
sure.
what all you all do?
Yeah, it's interesting. I'll tell you what, it's interesting because 3 things the statutes tell a coroner to do. Come up with a deceased name, who it is, find out the cause of death, which is the medical reason, heart attack, drowning, gunshot, cancer, whatever, overdose. And then the 3rd thing is the manner of death. For instance, a gunshot could be the cause of death, but is it suicide, is it homicide, is it accidental, or is it undetermined, or natural? And it's not a natural if you got a gunshot.
Right.
So it's our job by statute to determine which category. So we're not smart enough to know all those answers ourselves, the 6 of us, but we rely on you guys, the law enforcement, the fire departments, even funeral homes can give me some ideas when they're embalming if there's been an aneurysm, a big burst in a blood vessel that might be the cause of death. We have to rely on the medical examiners who are forensic pathologists up in Louisville to advise us. So it's a teamwork and determining those 3 things the statutes tell us to come up with. But it's our responsibility, and then we put that on the death certificate and file that. So a lot of interaction with a lot of agencies to come up with answers. And the families want to know it, insurance companies want to know it, a lot of reasons why we have to do these to get the correct answers for the death.
And Dr. Lee, a lot of people don't realize now when you start talking about how many deputies you have, one person can't always get the person out of the home if you're having to take, if the funeral home's not taking the person, you're taking the body.
Yes.
But you've got a new vehicle recently.
Yes, sir. Yeah, they got a new vehicle, and thank the county we've been talking about that for 2 years, and it's been a big help and allows us to get in and out of places that we weren't able to get in before with the type of vehicle we have, and the equipment we have now is a little easier on our backs and a lot of help. And of course, the EMS is usually first on the scene, and right. We're called usually after they arrive to assess the initial death. And a lot of times they're there to help us, so we don't have to do all the lifting ourselves, fortunately. But I know all of us and people in your field too have strained moving bodies around 400-pounders and so forth.
Sure.
So
Well, and years ago, and it hadn't been too many years ago, before you got this vehicle, that EMS was your main transport for getting a body back to the morgue.
Yeah. And we looked at some figures just a few days ago that the cases now where we are transporting bodies from the scene back to the morgue compared to what EMS used to, I forget the exact numbers, but I think it saved Hardin County over $200,000 in the 3 years we've been doing that with our vehicle, just keeping the EMS from having to use their vehicle and then their 2 employees to do our job. And so it's
because it actually takes a vehicle out of service.
Right, exactly.
And if you've got as busy as we stay, which is about 17,000 runs a year, as busy as we stay, it's hard to take one out of service to stay there. And
unfortunately, we see a lot of decomp bodies, and that's one thing I would encourage the citizens to check on your neighbors, elderly neighbors, that especially in wintertime, but anytime, summertime even, because they're not looked at. People are so busy going in different directions, and a person can lay dead in the maggots and all that, and they get in the truck, the ambulance, and of course that takes that ambulance out of service for the decontamination process. So it's a lot of factors that come into play here.
Ends up taking a lot longer than just loading the body up and assisting you all.
Exactly, yes, sir.
You know, we talked before we started, as far as death investigations that you see, you're starting to see, and have more over the years, started to see more deaths due to either illegal drugs, prescription drugs. Can you talk about that a little bit?
Yes, sir. In fact, the House Bill 1 that was passed back in 2012 addressed the drug problems Kentucky has. We were noted for pill mills, it was called, especially in eastern Kentucky, a lot of. And I-75 was a corridor from people getting from Florida on up here, getting hundreds of pills from a doctor without a good examination and checking into their history and all that. And there were people doctor shopping, as it was called, and gave us a bad reputation that caused a lot of deaths. So that bill instituted a further investigation, and at this stage we have our drug deaths have doubled last year from this year. Shana, our deputy coroner, one of the full-time folks, one of the best in the state, by the way. She's top-notch. You know her personally, that what she does for us. She presently is working with the hospital with the new administration, coming up with some guidelines to get red flags when the patients are entered into the ER, or ED they call it, emergency department. But patient may be brought in off the street from a drug overdose, but they've used Narcan, the antidote. EMS or PD has used that, and they got the person back. They get to the hospital and they're stabilized. They get up to ICU and they die 2 weeks later, and maybe from pneumonia or some sepsis or something else, when that was that drug overdose that got them in there. So
in the first place.
Exactly. So some deaths have been recorded as natural deaths that should have been accidental or suicide because of drugs. So there's Shana is instrumental in working with the 6 or 7 people in the administration to get those red flags initiated, so when they die 2 weeks later, the doc's not going to say, yeah, it's probably pneumonia, and they dismiss it as a natural death, when medicine or drugs, whether it be legal or illegal, we've got a chart here, excuse me, chart showing fentanyl is our #1 killer by far over prescription drugs and other illegal drugs. And now we're able to, pardon me there, Bryce, we're able to flag those now, and we'll be better able to keep track of the drug overdoses.
So, fentanyl more so over methamphetamine.
Yes.
Why do you think that's so, Doc?
It's, I think, easier to get. And on the street, they're lacing that with some illegal things and some impurities. And that's what's killing some people, too, that when you do the toxicology studies on the blood of the decedent, and they find those ingredients, it's amazing.
They've laced them with.
Yeah, yes, sir. And
well, you know, I want to drop back for just a minute and then come back to this, but a large part of you all being able to identify these things goes back to the training that you get nowadays that in the beginning when you started, that training didn't exist, correct?
Yes, sir, exactly. In fact, back then, the pathologist or I guess whoever we could get at the hospital maybe to draw blood for us. Now we're all trained to draw our own blood, urine, and vitreous fluid out of the eyes for drug testing, so that's a big help to takes, again, stress off other agencies.
Right.
But there have been a number of things that have changed, getting into the changes over the years. One thing I'd like to mention would be the coroners have mandatory training now, so we've become a more professional organization. Back 30 years ago, in fact, there was a House bill introduced by Joe Prather, who's well known in this area,
right.
Well-respected community servant and a personal friend of mine. And in fact, he and I are tied together by a grandson together too. So it's he's a neat man. But he was instrumental in getting that, sponsoring that bill back in, I don't know, 72 or 73. He and Dr. Studeville, we talked about, my predecessor, was president of the Coroner Association those days. So they were instrumental in convincing all the legislators how important death investigation is. And Joe made the comment it was almost like a train wreck, is a term he used. Prior to the 70s, the coroners had no professional training. Some probably did not need to be coroners. About 2/3 of the coroners in Kentucky are funeral directors, and back then they were just mainly interested in retrieving the bodies for their business.
Right.
Now there are still a lot of funeral directors, but they're into death investigation, getting the proper cause of death and dealing with families and making it right. So that has progressed. We have 30 hours of basic training. I told you a while ago about the 3 things we're required to do to get to be a coroner. Be 24 years of age in Kentucky, a resident for 2 years, a resident of the county 1 year. You get enough votes, you can be a coroner.
Right.
And then you don't have to know what a body looks like. But again, that professionalism that has come about from this basic training class up on either appointment or election, and then 18 hours each year to stay certified. It's made us more aware of making good investigations.
So much like law enforcement or any other profession now, you all have got to have an annual training.
Right,
I know we had 40 hours every year, and you all are doing 18.
Right.
And now I have to have 32 every year for emergency management. But not only that, but back when you talked before this training started, I would say a lot of the folks that were coroners were not like you. They weren't physicians or had any medical background
None at all.
whatsoever.
Right. They got their training in bombing school, maybe about knowing where the blood vessels were in the body. But nowadays, of course, there are only a few physicians, Bryce, in Kentucky that are, you'd think that would be a physician to be the coroner, but in Tennessee, you are required. The elected coroner has to be a medical doctor. But then he has lay people as deputies, like we do, to do his investigations, his or hers.
Right.
But here in the 120 counties, I bet there's not 10 physicians who are, I'm the only coroner. We do have a chiropractor up in Campbell County who's married to a Hardin County girl, as it turns out. But so most are funeral directors, and there's an assortment of EMTs, firefighters, nursing home administrators, a variety of people who become coroners.
But because you were a dentist, and are a dentist, you were able to do some unique things that others weren't across the state. In fact, that even put you on a state team that was called out to mass casualty events, correct?
Right, disaster team that I'm part of, and the Carrollton bus accident, airport 5191 in Lexington, and I'm on a federal team that DMORT that was in Haiti for 2 weeks and Katrina for 2 weeks, doing dental identifications on deceased bodies. So, and I teach a class to each year to the basic training to the new coroners about forensic dentistry. So, keeps me among a lot of folks, and I'm allowed by the state to help the state out then at times when they need some dental identifications, and it's helped being a dentist.
Yeah, and people don't realize that. I mean, by you taking dental records from the deceased, you can identify whether that's really them or not.
Yes, sir. It's come in handy, very much so.
Absolutely. You know, Dr. Lee, we talked about, as we went along, I said I want to come back to this. We talked about the illegal drugs that we're seeing, or prescription meds that we're seeing, and fentanyl being the worst, then methamphetamine. Do you see that being a major cause of death now that you're seeing as far as accidental or suicide involving drugs?
It is kind of increasing. It used to be the car wrecks and those kinds of things would be the major accidental deaths. Now the drugs are almost taking over that category of accidental deaths. So it's amazing, and it's doubled last year from
you brought up a good point. Car wrecks, suicides, people killing themselves, but some of it, the things that you're seeing, the reason that they got into those positions was because of some type of drug use,
Exactly.
possibly,
Yes,
even
sir.
too, right?
Our homicides, our domestic violence situations, and child death, which brings on another subject if we had time to address that. But back early days, there were a lot of, they call it crib death, you may recall, sudden infant death syndrome, SIDS. Now we've, the law that passed, the child fatality law in 1996 that passed, requiring us to deal with law enforcement, health department, and social services as a team to investigate these deaths better. And we're finding that co-sleeping, where a parent rolls over a baby, or maybe the baby's put in a crib and there are a lot of blankets and pillows and so forth that suffocate. So the death investigation has improved that way for child death too. It's so
I know Shayna on that team
yes, she
here
is.
locally.
Yes, in fact, she was filmed in Frankfurt last year with social services and doing what they call a doll reenactment, where you go in with the parent or the family member who last saw the baby alive, and then how they found the baby upon death that next morning. Position is it this way, or head covered up with? So she's on that team, state team, and actually it's going to be used. That film will be used to teach new coroners how to do some child death investigations. So we're fortunate.
Ask your question on if you were called to a scene, and our folks are watching now. If you're called to a scene, what's one thing that you would want, say, people that you're going to their house to realize, or even not to do before you get there?
Of course, once they make a call, usually the call is made to 911. When they realize their loved one is unresponsive, they'll make the 911 call, which initiates EMS, first of all, and depending on circumstances, law enforcement will respond also, or maybe fire department may respond.
Right.
Being quicker, closer maybe to the residents. So once that call is made, then they need to back off, and there's a tendency to want to love your loved one and hug them and all that, but sometimes there could be some evidence that's destroyed by moving the person around. And now when the responders get there, if CPR is to be done, they need to be moved off a bed and to a harder surface, as you know. But so there can be some evidence lost there, but the family should get out of the way, and it'd be the responsibility of those first responders to secure the scene, so to speak, to make sure nobody comes in and grabs items around the body. Do not take anything off the body that might lead into some investigation.
But we're not telling that today, not to hurt anybody's
Right,
feelings.
Exactly. You know, and it's tough when you got a child less than a year old and mama is holding them. I mean, it brings tears to your eyes to separate that baby from the mother. But it's so important that we not disturb evidence that can lead into a good death investigation to come up with that cause of death.
Absolutely. And again, we don't want to cause ill feelings at the house.
Yes, exactly.
And that's why I look at, your folks that work for you, all very professional folks.
I'm blessed.
You are very blessed. And even some of the folks that you've had that have retired,
yes, sir,
were very, very good to work with as well. Yeah. So you have been blessed.
I sure have.
When you're called to somebody's house, I know sometimes questioning family members becomes very difficult.
Right. And in fact, the hardest thing, of course, one of the hardest things is to knock on the door at 2 o'clock in the morning and tell a parent their new driver of the vehicle, teenage kid, is dead. That's, in fact, I still remember a case where we had 3 killed at one time years ago that went to 3 different mothers after midnight and got 3 different responses. I got knocked down backwards by one. She took it out on me being the messenger of the bad news. The other froze up and shocked, couldn't say a thing. The other one started beating her head against the wall. We had to hold her back to keep her from hurting herself.
Right.
So get different responses from people when you go to the scene. And then, of course, if they're there with the EMS and the EMS arrives at the scene and makes the call to the coroner when they realize there's no resuscitation able to be done, then the family should kind of back away. But when I get there, I try to backtrack and see what had happened prior to them finding the person unresponsive. And it's tough to get answers, and there's emotions, and that you got to be compassionate. If you don't have some feeling for people, Bryce, in this field, you don't need to be a coroner.
Exactly. I mean, it is always a tough situation.
That's right.
You know.
Yes, sir.
I know in the early years when my best friend Larry Calvert was
friend of mine
alive,
too.
you
Yes, sir.
know, I think about many times that we worked together with that, and you know, it's very difficult when you go to somebody's house, because sometimes they're thinking that they need you to keep on trying to resuscitate them.
Exactly. It can be disturbing to see the not giving up. I hate to use that word, but when there's not the constant going after the resuscitation efforts, and when you know it's futile if their body's in rigor mortis, for instance, already stiff, and there's no way to get the jaw open, and families don't understand a lot of that. And they just
exactly, they think that you can still attempt to resuscitate when they're in that. And they've been, when you get to that stage, they've been passed away for quite some time.
Several hours at that stage, yes, sir. Yeah. They could have died at midnight and then not found until 7 a.m. and they could be already sort of stiff and cold.
You know, Dr. Lee, you know, some people may have questions after their loved ones have passed away, maybe even before a funeral home picks them up. Can they call you all, you know, and what if it's after hours?
I'll tell you what, we're 24 hours. I keep that cell phone with me all the time, Bryce, and people can call me anytime. And I advise them a lot of times on leave families. Say, if you think of a question at 3 o'clock in the morning, you call me.
But if they would need to call 911 first in order for 911 to refer that
probably
after
just,
hours?
Yes, they could just say that they need to talk to the coroner on call, or the coroner that responded to their residents a few hours earlier. They can pass that word on, and all of us are happy to answer questions for families. We get calls days, weeks, months later. Sometimes they want to review a case they just couldn't talk about it initially, but they're relaxed to the point where they can talk about Dad's death 6 months ago. So we'll talk anytime, either in our facility or on the phone or whatever. Anytime.
And you know, another good thing is you all have a good relationship with all of the funeral homes in the area, so it makes it easy for folks to be able to tell you, hey, so-and-so's funeral home's coming by to pick the body up, and it makes it an easy transition for you all.
You got to keep that relationship. Yes,
absolutely.
Sir. Very important.
Dr. Lee, I knew our time was going to go by fast when we start talking about this, because we've worked together so many years, and we appreciate everything you all do, because not only is it a thankless job, but sometimes it's a very, especially when you first get there, kind of what some people, normal people would say, it's a very nasty situation that you have to be in.
Very much, yes, sir.
Yeah. Thank you, Dr. Lee, for being here with us today and for explaining. And folks, again, if you all have questions that you want to call the coroner's office, Dr. Lee, do you have your all's phone number?
Phone number at the office, 270-737-8834.
And folks, we'll put that at the bottom of the screen in case you all want to ask Dr. Lee or Shane or one of the deputies, Spanky, any of them, Pat Elmore, Tim Gibson,
Barry Brown.
And Barry Brown was our EMS director for many, many years. So
he and I went to basic training together back in '84. We both got appointed by Dr. Studeville as deputies at that time. So
awesome.
He's been there a long time too.
So if you all have any questions, we'll put that number down at the bottom of the screen again, and feel free to call Dr. Lee and ask him or any of the deputies. Thank you, Dr. Lee, for being with us.
Thank you, Bryce. Thank you.
Yes, sir. And thank you for joining us here on Hardin County Education and Community TV, where we try to keep you informed on everything that's going on in this big county that we call home and Hardin County. Stay tuned for what's going on in your student's life and what's going on in our community. I'm Bryce Shumate from Hardin County Government, along with my friend Dr. Bill Lee from Hardin County Coroner's Office. Stay tuned and we'll keep you advised of your community's activities.